Hello and welcome to my presentation of the poster Synthetic Balancing of Cardiac MRI Datasets. This work is being done jointly with Eric Arazo, Enric Moreu, Kathleen Curran, Nola Corner, and Quebec McGuinness, and myself. And basically, our motivation within this is that we saw that it's very prone specifically in real-world scenarios where usually models that are trained to perform as a part of the diagnostic or the pathology assessment of a patient that's undergoing segmentation of the different cavities within the heart. Um, and there's a huge drop usually in the performance on specific subsets of the data, whether if they are patients with different pathologies or other sets of circumstances for each of them. So in particular, we focused on balancing data sets towards specific diseases. And in this case, those were diseases with morphology changes with respect to a normal patient. So basically, what we aimed is to generate synthetic data through an atlas. So we got an atlas that represents a healthy patient, and we demorph it, we change it by using the spherical casting. So by applying the spherical casting on different regions of this 3D model, we changed the shape and we tried to mimic those. There were a set of ranges that we used to generate different ones. And through that deformation, what we do is that we slice this model as if it was a synthetic scanning. And we use then these mask-looking images to transform them into realistic MRIs. And the way to achieve that, in our case, it was through training a generative model that does image-to-image translation, and we did that by using the contrastive unpaired translation. Basically, what this does is that it ensures spatial consistency at the same time that it aims to learn representations also by learning negative examples. For instance, here, the squares means the query that it's aimed to be able to map features from one image to another at the same time that it enhances differences in the features from those different patches, which is it's a big part of this work. It works with by patches. And again, once this was trained with publicly available data set, in this case, the M&EMS2, we obtained these realistically MRI looking images that we use to train our model. So lastly, or training data setup or experiment setup consisted on having 4 different models where we had in all of them were trained with 40 real healthy patients, but and one synthetic healthy patient, which corresponds directly to doing all this process just to the atlas, a healthy atlas. But then we used 20 of our HCM-based synthetic patients for the HCM model, and with the dilated right ventricle to the dilated right ventricle. As a matter of control towards sort of control, we applied a set of traditional, more commonly used augmentation techniques, which include elastic deformation, and affine transformation, and this kind of morphologically changing images in an augmentation model. And in our results, what we see is that for all the cavities, and here I like to mention that the test set is based on diseases that are unseen that don't correspond to any of those, but also that the ones who correspond to these diseases. And what we see is that the results are better in our dilated right ventricle based model, performing better than the healthy kind of also control one, and better than the augmentation. but a little bit or HCM-based perform worse. What's interesting about this model is that while on the left ventricle and myocardium tissues, the dilated right ventricle performed better, in the right ventricle cavity, it was the HCM-based, the one that performed better. So for us, this means that we have to keep exploring how we are representing these diseases morphologically, how we're doing these changes, and we're doing this through validating it through clinicians. And at the same time, we're also trying to improve our synthetic generation or style transfer part. But more specifically, we're focusing on validating the technique with clinicians and also extending the augmentation data also to other types of diseases, not just morphological. Thank you for listening, and I'll be happy to receive any questions in the conference or through email.